I think it will always be typically hard, but I think in order to make it any easier, I think is with technology and being able to do something possibly with your phone or just make it easy, because it is pretty intimidating. I think men just don't really want to know. I think it's the fear factor of knowing if they're gonna, how long they're gonna be. They got a lot of, maybe they have family. They don't even want to deal with it. They don't want to be like, oh, I'm sick, and have other people worry about it. So I would believe maybe just make it easier, maybe a discreet way of doing it. I think us as maybe generations go on, maybe it'll be easier. Maybe it'll be different, but I do think it'd be best if to make things easier, because even me, it was always kind of hard to deal with medical stuff anyways, just the whole process.
A lot of it has to do with changing the mindset of men, right? Especially Latino men. We're known as being the providers, right? We have a role. Our role is to go to work, put food on the table, roof over heads. We don't have time for doctors, That's what my dad used to tell me. I don't have time for the doctor.
Yeah, that's true.
I gotta make sure your mom has food to cook. Make sure you have clothes. I gotta take you to baseball. I gotta go, we're so caught up in what everybody else needs that we forget about ourselves.
Yeah.
You're listening to Musings with Morales. Brought to you by Dialysis Education Services.
Welcome, everybody, to Musings with Morales. I'm Morales, and it's a special night. We've got one gentleman to my right, Omar, reoccurring guest. Thank you for agreeing to take the call again, Omar, and share the wisdom. I think the viewers on the last episode really got a lot of value from some of the insight that you have as a care provider. On the left, we've got a new friend, Justin. Again, thank you for taking the call, but also thank you for reaching out. I think you saw a recent episode of our podcast and actually offered to share with us a unique journey that you've been on. Excited to hear about that tonight. Again, thank you, Justin.
Of course.
Before we get started, we kind of put out a post tonight that we'd be talking about kidney failure and kidney care. I think there's a lot more that we should discuss tonight, because when we talk about kidney failure, kidney care, we're really talking about life. And with life comes a lot, right? That kidney failure and the need to actually really focus in on kidney care only complicates, because life is pretty damn hard as it is in a lot of cases. Let's set the playing field a little bit. Chronic kidney disease in the United States, there is approximately 1 in 7 Americans that are suffering from chronic kidney disease in one stage or another. Not all of them require any sort of aggressive treatment. There's a lot of lifestyle changes that can be done, medications, nutrition and dietary considerations that can be made, as well as physical activity, which we should all be thinking about from early ages, right? There are really 2 culprits in the United States that stand out, but then there are a lot of other players out there as far as causes of kidney failure. And really want to have a short conversation on that tonight, as far as the types of kidney failure that we've seen out there or experienced in comparison to the main 2 in the United States, which are type 2 diabetes and hypertension, really preventable type of conditions for the most part. And there are a lot of factors to a disproportionate representation in a couple demographics and populations, specifically African Americans and Hispanics, as a disproportionate incidence of chronic kidney disease, especially in the end stage where it requires aggressive therapies. As I think about this really common disease out there, and then how little most people know about it, anybody who's serving or evangelizing the cause, to kind of say, here's what kidney disease is, here's how blindsided you could be to it, here's some of the things you can do to prevent it, and not to say all can be prevented. But the 2 guests that we have here tonight, Omar and Justin, in my opinion, you guys are heroes in this plot of kidney disease in the United States. Omar, me having a long background with you, understanding the care that you put into patients, and as a dialysis technician. And then Justin, again, going to share your unique journey as far as the impact of kidney disease in your life. Why don't we start with just your stories of either kidney failure or kidney care? And Justin, since you're the newer guest to us, if you wouldn't mind getting us started, tell us about kidney failure, kidney care in your experience at this point.
Yeah, so kidney failure and kidney care kind of obviously tie hand in hand. When I was 9, that was when my first experience with getting into any medical field of experience. And when I was younger, I really didn't know what was going on. My mom was constantly taking me to this hospital, this clinic.
Oh.
And being 9, of course, you're just like, oh, okay, well, your mom's, is taking you over here. But this particular day was very different. And I don't even know what this surgery or some like checkup is called, but they stuck a small little tube in my pee hole.
Oh, gosh.
I don't know what it's called. You might, guys, and I believe they were checking my... It was a camera, actually. They were checking something. And I just remember being like, what the heck was that? Like, this is the first type of pain I've ever been in this clinic. And
that's the first type of pain I've felt like that as well. Just hearing it. That's oh, my goodness. Again, 9, you said?
I was 9.
Wow.
And so my mom sat me down, and we were driving in the car. And I remember this pretty vividly. And she tells me, okay, so you have some sort of kidney failure. One of your tubes from your bladder to your kidneys is a little too long. They have to cut it. Oh. It got infected, so that's why your urination isn't clear. Blah blah blah. It's not taking other toxins. She probably said it in a more kid way, but and that was the first experience of me acknowledging I had some sort of kidney failure. And that's when I had that surgery that year where they cut that tube, and I grew up with only having one kidney. 2 kidneys that equal as 1 kidney.
Okay.
So my whole entire childhood and adulthood, I was raised with 1 kidney.
Gotcha.
And after that surgery, I didn't think about it. The doctor said, oh, you're going to live a normal life. Don't worry about it. Which I feel like I could have got a better explanation or a better tip. But so, I drank, had a certain lifestyle. I, smoked weed and stuff like that. And that's when 2 years ago, my kidneys completely failed. And that's kind of the whole journey that took me from, as a kid up until my adulthood. And that's kind of when I started the whole dialysis and learning the kidney care and the kidney failure experience. And so all that kind of had a big gap in between, because I really just let my life be after that surgery, and then it kind of all came back in.
Got you.
Now.
And today what's your age again?
32.
32. So at 30 was where you had CKD5, I'm assuming.
Yeah.
Still maybe some residual function, maybe a little bit.
Yeah, I still urinate, but it just, I wasn't taking out the toxins. It was bubbly urination. And I really just thought it was normal, honestly. And I started to notice I wasn't peeing as much too. And I actually kind of just thought I don't know, it was just normal. I thought, I kind of tried to hide it. I tried to put it under the rug, and a lot of the symptoms that was coming, I just believed it was something that comes with age.
So, I don't know why I thought of this right now, but somebody at a conference or something one time was like, the best person to drive on a long trip is a person with kidney failure, right? And it's like, oh my God, okay, we're making jokes now, right? So are you that guy who's like, let Justin drive right now, right?
I think that is now, because I don't, but back then I had a problem where I would urinate a lot. I always had to go to the bathroom at one point.
Yeah.
I didn't know that was a symptom until later on, until I really think back and look. I'm like, oh, okay, yeah, so that was this was this. Oh, I see. This is all coming together. I did have kidney failure probably years ago, but...
What was the official cause or diagnosis for your kidney failure?
They still don't really have a clear answer. They just believe because of me growing up with 1 kidney, a lot of that just became naturally died off. And I probably wasn't having like a good a renal type of diet, which I follow now as much as I can.
Yeah.
So, I had the typical American kid growing up. You had fast food and stuff. You ate some home-cooked meals, had soda. You didn't really know about, the whole real diet for that. Yeah.
Well, let's come back to it. I think that's a great 30,000-foot view of your experience. I'd definitely like to dive in more as we kind of banter back and forth between, kind of what you experienced on the initial side, and let's look at somebody who came into this. Omar, I'm hoping since the last time we talked that you haven't developed kidney disease, but your purpose, or I guess your introduction to kidney care, how did this all happen? Kind of take us through that journey of, before you ever started dialysis to where you're at now.
Kind of started in between jobs, at a job as a home improvement sales representative. It was all commission based. Wasn't going too well because, during that time between, let's say, 2008, 2012, that's when you had those mortgage crises.
Yep.
So I kind of did some research. Wanted to do something where I can still help people out. because that's what I was doing back then. I was working in a program that helped low-income families and the elderly go through a program that was offered by the gas company in Edison to help them do minor home repairs to make their homes more energy efficient. Saw dialysis. I was like, hey, that sounds interesting. Did my research, saw that it was growing about average 11% a year. So then I started doing some research, came across DES, enrolled, went through the program, did an internship at the VA. And that's when I really kind of got a taste of what dialysis really was. Because one thing is to read about it and to learn about it, but experiencing it firsthand is completely different. Went outside of my career with a provider up in Beverly Hills. When I first started, I didn't really know if it was for me. I liked the conception of it. I was scared because there's, one thing is to take care of yourself, but to have the care of others in your hands is stressful.
Yeah.
Regardless of what field of medical you go into, right? These people are coming to you to feel better, so you have to be at your best. It took me, I would say, about 6 months before I really felt comfortable providing care to a patient. As much as the education that I got going through DES, it prepared me for it, but I really wasn't prepared to have those people rely on me 4 hours a day, 3 times a week. But through the time, I fell in love with it, right? I fell in love with providing care to those patients. Seeing those patients come in and, like, something still kind of stuck to me, right? Like, the most rewarding thing I've ever heard from a patient was, I feel safe and comfortable when you are here. And that's when I knew, okay, I'm doing something right. Let's keep at it. That was about 8 months into my career. Stuck through it, continued to, and it's a job that you have to continue to educate yourself because new procedures, new policies come out.
Yeah.
The technology hasn't really changed over the last, 15, 20 years maybe? Until recently, there's been integration of new machines, but they're not much different from the previous model.
That's right.
Just a little fancier on the outside.
Especially here in the U.S. I mean, there's kind of a lag from innovation around the world to what we actually utilize in the United States. And maybe we'll have a chance to kind of talk about some of the stresses on the system, on why that happens. Like, why is it that other countries are utilizing existing technology before we are here in the United States?
So, been doing it now for 12 years. I love it. It's fulfilling. It's a job where I get to, it's more like a playground to me because I don't feel like I work. Because it's my passion now. It's what I like to do. It's what I love to do. So when I go to work, I don't feel like I'm working. With, per se, family. Because these patients become like your extended family because you're with them. I spend more time with my patients than what I do with my older brothers, my sisters, nieces and nephews. So it's been very fulfilling. It's been very rewarding. It's gotten me to be recognized nationally. I continue to grow, continue to learn. It's been great so far.
So in the 12 years, excuse me, that you've come from that career change to where we're at today, like, what are the differences? I mean, I've spoke at high schools to kids who are kind of in their career pathways, right? And they're trying to figure out, what exactly do I want to do with my life? Some of them know they want to be in healthcare, right? But they'll say, like, CNA, MA, and when we tell them there's such thing as a dialysis tech, they have no clue. So there's this career as a dialysis tech or dialysis nurses. I don't know, is that what you came to do, was to be a dialysis tech when you went through school? Was there a bigger dream? And Justin, I'm going to teeter this back to you, is, kind of like when you think about, young Justin, young Omar, and you say that, I have big dreams. You made a career change, you got into this dialysis tech role. I know there's more than the atypical dialysis tech routine in your life. Can you tell me, like, how has it evolved?
Well, it went from a passion to doing the job to a passion to wanting to teach the job, right? So went into what you call in the industry a preceptor, right? Training new technicians to provide dialysis, provide the best care that they can. Alongside of that, kind of went into another role where I became a student intern coordinator. So now my job was to coordinate with schools and place their students in internship programs and try to get them to go to direct hire. So I went from providing the care to teaching the care, back to providing the care now, but also trying to change who we bring into the industry. There's a high turnover rate in this industry because real job expectations aren't really being set. There's inadequate training, lack of respect for new technicians coming to these fields, so they're not lasting. You know, they're a year, 2 years, 3 at the most, and then they're gone. And a lot of it comes from the culture that is built into the clinics, the lack of respect for new technicians. Just because I've been in the industry for 12 years doesn't make me better than somebody who's been in it for 6 years or 6 months.
So it sounds like, I mean, it's obvious that you love what you do, so much so that, you know, going to work every day, it doesn't feel like work to you. You feel fulfilled when you go home. I'd like to hear from Justin in regard to, you know, kind of current purpose, because I've seen some really interesting stuff on some of your socials. You know, the level of sharing, the granular level of it, like, you know, really to kind of get real with people. And you're a young man in 2024, different issues than, you know, the atypical dialysis patient, which in a place where Omar works, let's just say a male in your clinic, what's the average age of that person?
60, 65?
60. We're talking to a 32-year-old, you know, that's got like really cool businesses and ideas, and, you know, he's hip, you know, he's got swag, like it's completely different experience, right? So how has this experience of personal endurance now shifted or complemented your purpose in life?
Yeah, it's quite interesting because it changes. And before this whole situation, it was all about me. It was all about myself. So when I was dealing with this situation and going through dialysis, it actually taught me a lot. And I was just recently thinking about this because caring for yourself for a long time gets tiring. Like, so, you know, you're always worried about what I'm going to do. Oh, wow, what am I going to do here? What am I going to do this? And it got to this point where when I started making this TikTok, at first, obviously, it was for myself. I wanted to record this journey and kind of be able to look back at it. But as time goes on, it became this thing where I started helping other people. People were starting to come to me for advice and experience and wanted to get my, you know, just maybe wanted to talk to me. It was almost like I'm helping our community in a way where, and there was also a lot of young people that are also on dialysis, which I didn't know because same thing, when I was in hemo, everyone was 60, 70 years old. It was kind of miserable. I'm in there and it's not a really nice energy. And that threw me off. And when I went on TikTok, I started to realize, oh, there's a lot of people my age dealing with it too. And that's when I started making the videos, and people would reach out to me every day and be like, oh, you know, you're inspiration, you motivate me. And so that is kind of almost I felt like my new calling. And I felt like that became a part of me now, where I kind of like what you said, now you like helping people, and it becomes this thing where that's your personality. And that's something that I feel like I've unlocked. And that's the new me.
That's crazy. It resonates with me as well. I mean, I have definitely not experienced kidney failure, but, you know, I know I have a high risk, right? As far as the background and then even lifestyle, like, you know, sitting here talking on this podcast to people about what we do and then fitness and health. It's like, you know, I got some things brewing in my mind about my personal choices in life, right? Because like really any day in life, too many wrong choices can really lead you to a path that you don't want to be on, right?
Yeah.
So I hear that, you know, new purpose with sharing, with, you know, empowering, right? Empowering others. New purpose in the same in those that would actually be delivering care to folks that are going through the illness. And I think, you know, it's kind of one and the same, right? Like wanting to empower through the personal journey, the personal experiences. You also have personal experiences more from the care provision side. And it's really cool to have both of you here at the same time, actually, to kind of merge those two aspects of what the personal experience is going through it, what the personal experience is in somebody who's actually really passionate about helping others to go through it. You know, because ultimately, like, dialysis is meant to help people live, right? Whether it's hemodialysis, home hemodialysis, peritoneal dialysis, or, you know, kind of the golden goose of transplant, it's to help people live and get back to other stuff, because there's other stuff that we do besides breathe and perfuse, pump blood through our body. So, you know, as far as that purpose, you mentioned the the social aspects. Is it Platinum Kidney again?
Platinum Kidney, yeah.
Platinum Kidney. So that's your TikTok handle.
Yeah, TikTok.
And I kind of noticed out of most of the platforms, that was the biggest following that you've got there.
And I made a little Instagram that kind of, has some of this stuff, but mainly TikTok is where most of my engagement is from.
And this is an organization, isn't it? Like you actually have a...
No, not yet. It's an idea that I'm building up that I want to possibly put it into an organization, which is cool because now I get to talk to you. Maybe we can, get a little experience from that.
Well, we'll get more on kind of modality and things like this, but I can tell you that there's a whole new profession. It's kind of odd, but when we think about like the change in life, right? There's a whole new profession, which is actually kidney care advocate. Like there are companies that are actually, like the big dialysis companies, that are actually hiring people that are on different sort of modalities to be able to share their experiences with other patients, which is really a powerful method of teaching, right? Because one of the biggest things that we see as an impediment to learning is really like fear, right? And I don't know if you guys can speak to the kidney failure, the kidney care experiences that you have, but working with somebody who may be petrified, sitting in that chair thinking of like all the things in life that they may have interrupted or not get the chance to see in some cases, right? It's scary. And I think for me, working in dialysis for so long, it's like, well, there's dialysis. It seems so logical, so simple, right? Like you can continue to live. But for somebody who's going through it, like, and has never heard of dialysis, maybe, it's a completely different story, right? Like, I never heard of dialysis. Now you're saying that without it, this is a terminal illness, right? So what can you guys tell me about fear as a professional? And then on the other side of it,
that'd be
receiving
interesting.
care.
Yeah, you go first. I would like to hear yours.
So as far as fear, a lot of it comes from the terminology used to patients. It's not simplified, right? They're throwing all these words at them. So as a technician, like they come to us, they're scared. They don't know what's going on. They feel it's the end of the world for them. This is their life now. They can't do anything else, which is not true. A lot of times doctors don't educate them right away on the different modalities that are out there. They just go straight to in-center. Sometimes they come from the hospital with a catheter with no explanation. So we need to do a better job at explaining it to them in terms which they are going to be able to understand.
Yeah.
Right. That's what I think where a lot of their fear comes is they don't know truly what's going on. They're just told, you're CKD5, you need to go to dialysis. We need you at the clinic on Monday morning, 4 a.m.
Yeah.
Right. That's what happens right now. These patients, especially like older patients, suffering from dementia, their cognitive level isn't there. They're not understanding what's going on. A lot of times they don't meet with the family and explain it to them.
Just kind of pushed around.
Yeah, just kind of pushed around. So that's the thing where a lot of their fear comes from. It's the uneducated patient is the most fearful one.
Agreed. I mean, isn't that kind of everything in life, though? Like, if you don't really know about it, it's scarier than if you know about it. Like, I can't even think of a great example right now, but like, ignorance is scary to me. The unknown is scary to me. I'm walking in a place, that I've never been, that I don't know people. I just went to the Philippines, right? There were parts that were scary just for that simple fact.
You're
that
in
it was
unknown territory, it's kind of hard to figure out where you got to be.
How about you, Justin?
Yeah, fear. When I was in there, I really didn't have time to think and have fear. It was interesting. I had so many family. I had so much friends in there. When I heard the news, I'm trying to replay this whole situation, or the whole scenario. And I just remember while I was there, I was just trying to make sure everyone else was okay. Because I feel like a lot of people were kind of scared. They were worried. They're asking me. And kind of had to put on that face and kind of be that guy that's like, I don't know. Yeah, let me just figure it out. And that was kind of my whole reaction. I feel like I didn't have fear until everyone was gone. I went home. I left the hospital. I had to everyone went home. I had to really sit back and just think, okay, what is going to be the next step? How am I going to live my life? What is going to be me in the next 10 years? And that's when I had I guess you could call it fear, or at least I had to really think and use my brain power to figure out what's going to happen next.
Yeah.
But yeah, it was hard to have fear or have any sort of opinion on anything, because it was just so much people were there, and I saw that first big machine come in, which is a lot different than the one that you guys use now. It was like I guess the hospital hemodialysis is different. That thing is huge. That thing came inside my
Like a
room, and I was
train,
like, I gotta be hooked up to that thing.
Yeah, we call it a choo-choo train. So there's a machine, and there's a whole water
train,
system, like a big cart behind it, right? So yeah, it can look very intimidating.
So that feared me for sure, because I was thinking, do I got to bring that thing around? Like, But other than that, it was not until I got home and truly sit back and really gather my thoughts.
How long did you do? How long were you in the hospital?
I was there for 7 days.
7 days.
Yeah.
And then discharged and dialyzed at a dialysis facility?
Yeah, I was at a dialysis facility. They had a catheter through the artery. That was my first catheter port. And while I was there, they had scheduled me to do PD. But they talked to me about it. They sat down, and they had a couple doctors and other dialysis patients too. Or not, I don't think it was dialysis patients. I believe it was techs. They came in and they explained what hemodialysis was. They explained what PD was. And with my lifestyle, they recommended PD. And that's kind of when I got scheduled to do that port. And that's why I was there for a while. There was a lot of complications on the days and stuff like that. So that's why I was there for quite a while.
Can we dive into that a little bit?
Yeah, of course.
So, two questions. Your lifestyle and, more conducive to PD. I'd really love to kind of hear what that means. And then also, how important were those people that were sitting there talking to you and teaching you? Like, what impact did they have? What were they like,
Yeah, they were techs, and they were kind of explaining to me what they believe would be the best idea. And all of them did, even the hemodialysis people, they really did believe that the PD was better for me, just because I did tell them during the day I like to be out, I like to do my thing. I don't really want to go to a clinic three days a week. It didn't sound very appealing at that time as well.
Yeah.
And they just said I could do PD at home. So while they were giving me the training, they were explaining everything, I chose that, and I agreed with it. And my family did too as well, and I believe that was the good choice. And I think I did a good choice. I like PD, and I did like hemodialysis too. And I'll tell you what, I think the texts are pretty cool. I think like when you're talking about like, I had some pretty cool Filipino texts, and they're always really funny, and they were always, they had that uncle vibe. They're always joking with me, kind of doing sexual jokes,
Michael's like,
and so I did enjoy going there. It kind of gave a little mission of the day for a little bit.
Man, that's great to hear. I mean, without saying the clinic name, like what area did you dialyze in? Because
it was downtown.
Downtown LA.
Yeah.
All right. So I mean, that's really good to hear. Like they're in that like kidney advocate position, right? And one guy I'm thinking of, I think Omar, you've met him, maybe Sam Trevino. He's out of Texas. I think El Paso, Texas, if I'm not mistaken. You should look him up. He's got definitely a company called or a non-for-profit called Urine Inspiration.
Urine Inspiration.
Great story. But he really gives a lot of credit to the doctors, the nurses, and actually he really drills down and goes like the techs were, like they were kind of like my backbone, and kind of like similar stories. Like they had jokes, and it made the environment a place that was, hey, let's remove fear by creating comfort, identity, some commonality, share some stories, and get people through this, right? Back to life. So super, super encouraging.
Yeah, we're there to do more than just renal therapy. We try to make it as comfortable as possible.
Yeah, you guys for sure do.
But, a big contrast is when they're in the clinic with you and I, right, which is 3 times a week, 4 hours each day on average, right? Versus doing something like PD. We can say like, well, I can only help you for 12 hours a week if I'm a dialysis tech or a nurse, right? And that's not actually true, but like the time that I'm working with devices and putting needles in and monitoring vitals and things like this, that's 12 hours a week roughly, right? But like you said, we're there to do more, and that empowerment that you're doing on a personal level now, and that Omar has said that, he really wants to help duplicate among his philosophy of how to empower patients, teaching them, empowering them, and then duplicate that with new technicians and the people that are coming in to the industry. It's powerful.
It is, yeah.
So what about the change in life physically that you've seen in people you work with, Omar. And again, we kind of tapped the average age of your patients, around 60 in your experience. What sort of complications, and let's not say like, the causes of kidney failure, but more so like now that kidney failure has happened and they're doing, in your experience, hemodialysis 3 times a week, like what sort of stuff do you see in between the treatments? Like when they come back, what do they say? Like, I feel like this, this hurts, that hurts, I can't, what are those things that they're having complaints of?
Most of the time it's shortness of breath.
Shortness of breath. What's that from?
Fluid overload.
Fluid overload.
A lot of them are told you can only consume 2 liters.
Mm-hmm.
But they don't know what 2 liters is like in this.
Yeah.
Right? Like for me, I always tell them, don't drink any more than what's in the Gatorade bottle in between treatments.
Mm-hmm.
That's your goal. Right? A lot of they're given numbers, but they're not shown those numbers.
Mm-hmm.
Right? That's where a lot of we need to do a better job, dietitians, technicians, of giving them visualization of those numbers, or what they need to do, what they need to eat. They're told what to eat, but not how to prepare it.
Yeah.
Right?
You remember we met with Jonathan Diaz.
Yeah,
I don't know if you saw our episode with Jonathan Diaz. He does a lot of, he builds the recipes and posts the recipes.
Yeah, that's actually really cool.
That are kidney friendly,
Cool.
There's always, they're complaining of itchiness. That's one of the biggest ones.
Yeah, and what's the cause of that, or what are some of the...
High phosphorus.
High phosphorus. Okay, so...
I had a patient that ate a gallon of ice cream the other day. Right?
Oh.
Came in on Monday. It's like, I'm itchy. He was like, well, what you eat? Well, I had a whole, tub of Dryer's vanilla ice cream. I'm like, well, there you go.
Full of phosphorus, yeah.
It's...
How about you, Justin? Like complications that either you've experienced.
I love when you talk first, because you're giving me like, dang, you're right, man. Yeah, they don't do that. I like when you go first. But that's actually one of the things they don't tell you visually, and I would have loved that too, because it's really just information overload. Because they do give you that packet, like, here's what to not eat, here's what to eat, here you go study with your parents and your family, and there you go. And I was just like, and I hate kind of sometimes looking through, and then you just see, it's just like potatoes. Don't eat this, the way of teaching is, I believe, is old school. They could definitely teach you a lot better. I don't know the answer to that, but I do agree with you. I think there's a lot of ways.
Approved.
Yeah, Dallas approved. Yeah, there you go.
That's his.
There you go. There it is.
Instagram handle. Yeah, he's got some cool stuff.
Yeah. So same thing. The water situation. I do try to keep in mind not to drink too much fluid, too much water. But of course, with PD, I'm taking fluid out every day, so I kind of do a little bit more than the usual. And I think that's what they told me too. Since if you do hemo, you won't go there for a while, so you got to kind of chill out on the drinking. With PD, I'm technically doing it every night, so I'm able to at least take out some of the fluid every single night. But yeah, that is true, and just being able to have more visual, that would be a really big plus, especially for people like me or even older. I'm assuming they probably feel the same too, just looking at a big packet.
Well, let's face it, nobody really reads labels and measures their food unless they're like a fitness expert, like bodybuilder or something like that, right? They're measuring their grams and like exactly how much their food weighs, right? So it's tough to diet, period, which is why obesity is what it is in the United States. But also malnutrition can be what it is, even in unpoverished environments, right? People can be malnourished. They're type 2 diabetics. They eat a lot, but they don't eat anything that's nutritious, right?
That's true.
Yeah.
And that's another issue, right? With these patients, a lot of them are anemic.
Right.
Right, because they're afraid of gaining too much weight in between treatments, so they don't eat as much. They don't drink as much. A lot of them come dehydrated before treatments, coming in with low blood pressures. Sometimes we can't dialyze them because the blood pressure's so low. We got to send them to the ER. It's the lack, and especially for the Latinos. Pretty much all the food we eat is bad for you if you're a renal patient. Everything, right? Most of our products are tomato based.
It's the short life diet, right?
Short life diet.
It's and that's what Jonathan's handle is. great because it gives a lot of these patients ideas on how to incorporate these foods that they are allowed to eat.
Yeah. And one thing I like about Jonathan's page and anybody who thinks like Jonathan is if I've grown up, let's say I'm 46 years and then tomorrow I have kidney failure, you're not going to turn off what I like, right? I'm going to still like the foods I like. And some of that's got culture behind it, right? Mm-hmm. Some of that is,
comfort,
the way we comfort and the way we spend time with family, right? The way we sit next to a barbecue or have a drink or things like this. So it's a tough thing to change when you've got decades of habit behind you, and then, well, you have kidney failure, so you're supposed to just do it like that. Have you had any challenges in that regard, Justin? We all do it, right? We all
of course
don't eat what we're supposed to eat, or maybe have a drink too many, or smoke a cigarette or something.
I will say I have a really good discipline. I think when I put my mind to it and I get into that little space, I'm really good, because I did smoke weed every night before I went to go to bed, because I had a hard time sleeping, so I would use it for that. And of course, going out with friends and having a good drink, I was able to completely stop that immediately. Mm-hmm. I'm really good at being like, well, I'm not gonna do it anymore, so I'm good. So I have a pretty good discipline. But the eating part that was probably the tricky one. Like you said, I mean, everyone loves a good meal. If you want to have like potatoes is high in what was it? Obviously potassium. Potassium and phosphorus. Yeah, and I love potatoes and I love cheese. I love dairy. I would drink coffee every day too as well. So I had to really change my ingredients. I had to go almond milk, and I had to do 2 special shots over. So I had to I did change a lot of my stuff, and it was kind of fun. I made it fun in a way too. Or I try to trick my mind and be like, oh, okay, well, this is a fun, little change. I'm getting older now. Maybe I should think about this stuff anyways. So I try to put it in a positive light when I was changing my lifestyle. I had a complete now, boom, this is what you got to do.
I like that. So when you say something to yourself, then you're able to.
Oh yeah, I'm good at that. I could stop it.
That's a great quality.
It's like a superpower in a way.
Yeah, I need to get some notes on that. So when I say it, then I'm going to do it 100%. Vices especially.
For sure.
Food has become more of an issue as I got older. Right?
Yeah.
So Omar, we in a hemodialysis clinic, again, we do 3 times a week. We help people get dialysis, which is going to replace the functions of the kidneys. In peritoneal dialysis, it's more frequent, right? So there's a little more liberalism in how much you can drink and eat. And did you have to take phosphorus binders with peritoneal dialysis?
Yeah. I still take them, with hemo and PD. Yeah.
As many or less?
To be honest, I don't really remember if it was, but I feel like I've been eating more as I went. So I mean,
gotcha.
But PD is weaker anyways compared to hemo, I believe.
In the given amount of time, it doesn't do as much. That's why it needs to be done more frequently.
Exactly.
But it also has benefits because it's done more frequently, and also
true.
Don't need
There's diet restrictions.
Yeah.
Yeah, and then I think just not needing somebody else to do it. Not having to put a needle in, but being able to kind of access in a much quicker manner, and we'll kind of go down that.
Well, you're more
road.
in control of your care.
Yeah, yeah, and I always say that who loves me more than me, right? So exactly. better you take care of you than me or him, right? You love yourself more than we do.
Oh, for sure.
We love you too, man. But it's just a fact of life, right? That you want the best care, do it yourself. Now, not everybody can do that.
You really got to put yourself in a mindset on really, having accountability on how much you care about yourself. Yeah. That's true.
And fear can sometimes conquer the confidence to do that for some people. So I was at a conference over the weekend in San Diego. It's called the Annual Dialysis Conference. There's a heavy focus on home dialysis, home dialysis is really underutilized in the United States, even PD. But home hemodialysis is really almost non-existent. Just very low numbers of patients that do that. And one of the biggest reasons is there's a big learning curve, right, with PD and especially with home hemo. But when you're paralyzed by fear, it's like, if we're talking right here and there's a rattlesnake on this table, I don't know if you're paying attention to me. I kind of doubt it. you're probably paying attention to whether that rattlesnake's about to snap at you, right, and put you out of your misery, right? So we've got to help patients to really feel more comfortable, overcome the fear, educate, empower, in order for us to see any progress in that home dialysis utilization. But what I wanted to get at is, we when we look at people who are utilizing the 3 times a week dialysis versus people who are utilizing them more frequently, somehow we have to keep tabs on how they're doing. Some of it is like we talk to people, or we're talked to, and they ask us, about our energy level and about our mood, and about different sort of complications like how we're breathing and whether we have any itching or pain or stiff joints or anything like this, right? But the other side is that there's regular blood work that goes into the assessment of somebody who has kidney failure. We draw the blood because the kidneys are a blood processing organ, and when you lose the function of the kidneys, then the blood is not processed and it falls out of balance, right? Mm-hmm. So dialysis is supposed to bring it back in dialysis, and one way that we know that is by measuring the blood levels, comparing it to what the norms are. So I'd really be interested to start with you, Justin, in what are your experience with these blood draws, from the emotional perspective of it. What do they mean to you when you get the results? And then back to that, how is it being explained? Did you grab it all, or are there still gaps in kind of what you have understanding and why it's important to you?
Yeah, I definitely fell in a rabbit hole of learning more about the body as I've been dealing with this. It's actually kind of fun, and in the very beginning, I was always nervous for some reason I don't know, I'm afraid of needles in a weird way. That's also kind of why I wanted to get away from the hemodialysis, because the whole needle thing.
Yep.
Obviously, with time, I've gotten a lot more used to blood draws, but I always still kind of back in my mind, sometimes they'd be missing. Even the last time I was at my clinic, they actually missed like 2-3 times. I had to bring another nurse in to do it. Yeah. And that always kind of freaks me out. But I do appreciate it almost seems like a luxury, because you get these people, these dietitians and these labs to be able to bring you this info and data, which a lot of people don't even really get.
Right.
And I actually do see it as a luxury. Now I do.
It's a shame it has to be at that stage that you start getting that sort of information about your health, right?
Exactly. And I think a lot of guys have that problem too, compared to women. I know women are really on top of it, most generalizing. But
you're saying about going to the doctor, getting blood draws.
Exactly. A lot of my friends that are guys that they don't, maybe once every 10 years, or when something happens, then they go and get blood work. So I see it, like I said, I see it as a luxury. I do take it all in, and it's kind of fun to kind of be able to mess with the blood work and figure out what I got to do with vitamins or what I got to do in order to change that. I do think that's fun, and I think the anatomy of body is so interesting, where I feel like I can maybe I could change this, or maybe I can find a way to, be a superhuman after this point, So I see it as kind of fun.
That's a great perspective, silver lining and everything. But I never thought about it that way. It's like, I guess we've been talking about like a reactive healthcare system, right? We wait till things are bad, and talking about men, I think we've talked about, especially Hispanic, Latino. Omar and I kind of know about this, but it's like really stubborn to get any care, right? But the point where you're going to get everything in this scenario is when you've got like a serious illness, right? Type 2 diabetes, hypertension, chronic kidney disease, and then you start getting all these diagnostics. Pretty cool. And off script for me, but what do you guys think about like getting ahead of things? You mentioned the stubbornness or the disregard for health among some younger men. What do we need to do as young, you're an Asian American, right?
Yep.
Young Hispanic American, Latino American. What do we need to do to kind of get past that? And let's just focus, since we said men, and we've talked about this before as well. What do we need to do to focus to help men get over that and get to the doctor and get an annual and start to get the stuff that hopefully they have insurance to cover already?
Yeah, that's a good one. I do think about that quite often, and thinking about how I would have maybe changed it. But I think it will always be typically hard. But I think in order to make it any easier, I think is with technology and being able to do something possibly with your phone or just make it easy. because it is pretty intimidating, I believe, and I think men just don't really want to know. I think it's the fear factor of knowing if how long they're gonna be. They got a lot of, maybe they have family. They don't even want to deal with it. They don't want to be like, oh, I'm sick, and have other people worry about it. So I would believe maybe just make it easier, maybe a discreet way of doing it, possibly.
So it's
I
like
have no
just
answer to it.
between you and the test, and nobody's going to know about it?
I think us, as maybe generations go on, maybe it'll be easier, maybe it'll be different, but I do think it'd be best to make things easier, because even me, it was always kind of hard to deal with medical stuff anyways, just the whole process.
I think there are, I know there are. I actually like have an investor spirit in me, right? And a company I invested in, that's actually the vision is to have a platform that is even just as you describe, maybe performed
awesome.
through a phone or an app, where you have the knowledge just at a point of care, versus having to do like a lab diagnostic, get your blood drawn, send off to a lab. There's a lot of technologies that are being worked on like that, and I'm lucky enough to be a part of a company that's working
cool.
on that. What do you think?
A lot
Omar?
of it has to do with changing the mindset of men, right? Especially Latino men. We're known as being the providers, right? We have a role. Our role is to go to work, put food on the table, roof over heads.
Yeah,
right?
provider.
We don't have time for doctors. That's what my dad used to tell me. I don't have time to go to the doctor.
Yeah, that's true.
I gotta make sure your mom has food to cook. Make sure you have clothes. I gotta take you to baseball. I gotta go. We're so caught up in what everybody else needs that we forget about ourselves.
Yeah.
Right. I think educating that we're just not. If we don't take care of ourselves, then we can't be the providers that we're expected to be.
Yeah.
Right. A lot of it, we need to change that mindset. Through education, through awareness. Even with kidney failure, right? It's not much awareness of it, because there aren't pharmaceutical companies profiting really big on it.
Right.
Right.
Yep.
That's what is not out there. You got all kinds of medications for pain, for high blood pressure, diabetes, but there's nothing that can really, it's gonna reduce kidney failure. So there's no awareness for it. The awareness is coming once somebody already has it and they're speaking out on it.
Yeah, pretty much.
But there's nothing from like the doctor side, from the pharmaceutical side, out there.
Well, when does Medicare start covering for chronic kidney disease? Only in the
End stage.
the last stage,
Yeah.
the fifth stage of it, right? Which is just almost, we can compare that to a buffoon, right? Like why is that the only time you focus on it? I had a couple of CEOs or C-suiters from China come to visit me 2012 or so, and they just basically asked me to consult and share kind of the way we do things in the United States. And when I described the reimbursement system, they started laughing, and they just said, like, oh, that is so stupid. You guys only will invest in a person's health when it's at a stage where it's terminal. Why not put more money into the upstream side of it in helping people to prevent it? And that's a whole series of podcasts and also Netflix series out there, right? About what we're putting in our bodies today, right? And the difference in ingredients in the United States versus other countries even. We know that this is a bad place to eat, but it tastes good.
I get into that stuff too. I'm always at night like researching, like, whoa, America, like compared to other countries, it's fun.
Yeah.
It's good to know.
Yeah, it is. I mean, it's good to take into the frame of thought, right? Like as far as how calculated things like that actually are, or at least you could perceive them to be. So let's take a shift. We all have things that we live for that give us purpose. The need for dialysis. Let's think about the people you work with before they needed dialysis, right? And let's just think about you as well, Omar. Like, what are those things? What are the things that give you hope and purpose and joy in your life? Like, what's life for you?
My kids.
Your kids.
Yeah, that's what gives me hope, right? Everything I do is for them. Right. My role is to make their life better than mine was. Right. My dad made my life better than his was. Right. And I want to just keep that going. that's what gives me hope is seeing my children develop into responsible citizens, right? Great people. That's all. That's what gives me hope. That as far as our field goes, dialysis is kind of going through a big change right now as far as staffing goes. Right? There are quality technicians coming in that are not from a vocational school. It's not that great.
I really like to kind of take the focus off dialysis right now, and let's just talk like what's life, like you obviously, and I know you well enough, like you've got how many kids? Four kids. Yeah, I was gonna pull one up. 4 kids. You're a husband. Your life is about your family, and the sacrifice that you've given, which you actually really enjoy, is all for them.
Yeah.
What do you do for yourself?
Honestly, nothing.
Nothing.
And occasionally I go on a hike, right? That's like my thing. That's when I get to go and escape from everything I like doing, right? Occasionally, when the weather permits, right, where it's not too cold. Because if it's cold, I'm not going out. Right? I'm all with my joints hurt if I'm out there and it's cold. But that's what I do for me, right? I'll go out, wake up early because I'm an early riser. Something my wife hates. She don't like me getting up. No matter what day of the week, I'm up by 6. I can't sleep past 6. I just got so used to waking up early that my day always starts early. But for me, it's like I like just going out there, just being in nature by myself. I don't need nobody around. I get to just all I do is think about that next step, and that's it.
I mean, it's pretty cool, and I think probably resonates with the internet a lot. That the man that kind of musters up everything for other people, right? And when I ask you what's life about, it's other people, and when I ask you what do you do for yourself, you have somewhat of a hard time, in answering it. But you found nature, right, which is I think a great medium for peace and finding reflecting on yourself. But yeah, unique or not unique, I'm not sure. I think there are probably a lot of men out there that that resonates with them as far as their purpose and what makes them happy. How about you, Justin? What is life for you? What beyond all the stuff we've been talking about before tonight? You got some really cool stuff, but I'm sure you got more cool stuff that's not represented in your social media.
Sure. You make a good point though too, because I believe a lot of men, their purpose is to make sure everyone else is happy.
Yeah.
And I understand that. I understand that. And I think with my age too, I don't have kids, but I do have family and I do have friends. And a lot of the times, I just want to make sure they're good, and that makes me happy. If they're happy, I'm happy. I mean, it's a weird thing. I think when you get older, you start to realize happiness isn't really what you wake up for. You don't care about his happiness as long as everyone's good, everyone's safe, everyone's just happy, then you're happy. It's a weird way of living, but I feel like I've come to that stage too. When I was younger, obviously I would wake up and go, oh, what's gonna make me happy today? I was a kid. But then as you get older, you start to realize that maybe other people's happiness makes you happy, and that's what you kind of go for. And I guess it's a provider type of mentality, even though I don't have kids.
Yeah.
But I see that with my family and friends.
Yeah.
They're good, I'm good. And
you're a good guy, man.
But
Definitely.
What makes me happy, fulfilling? Yeah, it's a hard question because it's always changing. Like I said, this whole change of life. That's what I see now is making sure everyone else is good, and that to me is good.
Yeah, I think as men, we think of our happiness as our younger years, right? That's when we're happy. We kind of shift mindsets as once we become fathers. Our happiness is seeing everybody else around us be happy, like Justin saying. Right? As long as my kids are happy, I'm happy.
Yeah.
Right? Eventually, they're gonna grow up, leave the household. They're not worried about me. Like my mentality is, I'll worry about me then.
Yeah.
Right now, like I said,
you might worry about the grandkids then.
Yeah, and I seen how much joy, that kind of brought. Fortunately, my mom passed away before I had any kids, but I saw how much joy that brought to my dad, seeing him have grandkids. I see how much joy that gives to my in-laws, because they're like my father figures now. You know, like, 'cause that's who I go to for any fatherly advice, motherly advice. I go to my in-laws 'cause that's all I have now. Right? And seeing the joy that these kids bring them, I was like, okay, I'll have that happiness when I'm older. Right now, as long as my kids are happy, I'm fine. I know that I need to take better care of myself, and I need to find something that makes me happy. Because in order for in order for you to make others happy, you got to make yourself happy first.
Yeah,
right?
agreed.
Before you love somebody else, you got to love yourself first.
Yep.
That's true.
Right?
Yep.
And for a very long time, that wasn't my mentality. It's like I don't need love. I just need respect.
Yeah.
Yeah.
That's
Right.
true.
Because that's something my father told me. I don't need you to love me. I just need you to respect me as your father. That's it. You don't have to like me. You don't have to love me, but you're gonna respect
While he's
me.
holding the shotgun, right? While he was
Nah,
holding the shotgun.
Respect is a big thing.
That's
for
when he
men.
bought that.
Yeah.
You know,
It's the only thing you want.
you know,
Sometimes.
right.
in our culture, it's called la cuarta. Is the whip that used to be horses with, right? Like, if you don't respect me, this is what you're gonna get. Right?
You get the stick.
Yeah, and I think we need to kind of change that mentality, right? That, yeah, we need respect, but as men, we also need love. And we're in our culture, Latino culture,
Yeah.
that's on tell their kids I love you.
Yeah.
I try to tell my kids as much as I can because, you know, both my parents passed away at young ages, and I have that fear. It's like, is that going to be my fortune too? Right? Am I going to pass at a young age? So I try not to say that as much as I can.
Yeah.
Because I don't know, right?
Yeah.
And my wife said, well,
that way you know they know.
Yeah, and then my wife tells me, well, you're not doing what your dad did, and what your mom happened to your mom was just a freak accident, and you know it was unexpected. I'm like, yeah, but what if?
Yeah, we don't know what today or tomorrow really has got for us, and you know I can appreciate that. Like I think I'm an affectionate dad. You know, like I hug and kiss even my boys. You know, even the one you guys saw earlier. Like it was only recently that he got too manly to do that all the time, right?
Yeah.
But it was like even in high school, I drop him off and kiss him in front of the high school, right? Like,
No.
it's
Yeah,
like-
that's embarrassing. Too.
Yeah, he was.
Yeah,
He was good
I
with
have
it,
my
man.
limits.
Yeah.
He was good with it, man. For the longest time, but so there's more to life than dialysis. There's more to life than like focusing on illness or even health, right? Like we can't just focus all our time on like doing the right things. Like there are things that we do that sometimes are dangerous, even, right? Maybe it's thrill seeking, yeah. Like we like to bungee or some of these extreme sports, maybe MMA, stuff like this, and a chronic illness could interrupt things like that, right? Like especially the extreme, right?
That's true.
So majority of the people that you've met have been like 60, and they're probably not needing to go back to mixed martial arts and stuff like this.
No, but-
You said you've talked to a lot of younger patients. Maybe they have stuff that they're really like they had to cut it out when they had kidney failure. But let's talk rehabilitation for a minute. Getting back to the baseline. Experiences with that with your patients, Omar, in your life personally, Justin, or with the people that you're also mentoring or kind of giving guidance to. What have we seen as far as rehabilitation? Tough one.
Yeah, it's a tough one because you don't see a whole lot of it.
So again, we're talking different environments here, right? Omar, you see a space where people come in to get treatment, quite often not even educated about a home modality, but even when they are educated, maybe it's not the right fit for them for whatever reason. So when they're in the in-center, it's not uncommon to see a decline in physical status, right? But when they're at home or when they get transplants, especially, like we quite often see an incline from where they were when they dropped down. So I'd really like to hear if you had an experience with like a patient or in life, and I kind of think you've got the story probably because hospital versus where you're at now, you've rehabbed, right?
Yeah, in a way, for sure. Yeah.
So So what's the? Can you speak on that a little bit, like status as far as baseline before and where you're at now? Are there setbacks still, and if you've overcome them,
Yeah.
how did you do it?
You know, I'm a lot healthier for sure, which is really funny. And I am pretty active on working out and stuff like that, which the clinic actually prefers not for me to work out, which
I
is
saw
an
you
interesting
working out
thing.
with the weights, right?
Yeah, I do all the time.
Yeah.
And so, you know, I get into little conversations with other kidney patients, and we always kind of talk about it. But of course, it's really about feeling how your body reacts to working out. I don't recommend going there and start benching and start doing some squats and doing some core workouts, because obviously that can mess up your catheter or whatever you got whatever you got going on.
Yeah.
Especially if it's a lot.
Yeah, fistula. So yeah, I have my own ways of doing things. I work out actually more than I ever did before, because it was more of, I had the will to live now.
Yeah.
I had this different mentality. I feel like I'm a monster. I feel like I'm a warrior in a way. So I changed my whole framework of how I think and how I see things and how I respect life. So I work out as much as I can. I do push-ups every single night. I love MMA. So after you were talking about it, so I watch UFC. I'm always in it. I grew up doing Taekwondo. I used to wrestle. I used to always mess around, do Muay Thai, Jiu-Jitsu and stuff like that. So I still do it in a way where it works for me.
Right.
And obviously in clinic, when I was in there, yeah, like you said, everyone, it's not pretty. Dialysis is not pretty regardless at the end of the day. So when you're in there, you can really see that mindset really kind of go down the drain. When I was there, it really was, I didn't talk to anyone. Everyone looked miserable. It almost looked like it was the end of life when I was in there.
Right.
But when I got out, that's when I started to be able to like what you said. And I was able to kind of come back, start working out. I felt more confident. I felt like a warrior out there, and I wanted to defeat this thing. This is my battle.
Yeah.
And that's kind of how I had to do it.
I've heard the term warrior used by several, people who've fought the battle, really. I mean, when you talk about a battle or going through hell, kidney failure is absolutely one of those things that I think you've earned the title of warrior at this point, and a victorious warrior at that.
Exactly. When I work out, I feel like I'm getting ready for battle, because every night I got to hook up. I got to set this thing up at night.
Yep.
So when I'm doing my push-ups while I'm setting it up and it's priming, I'm doing my push-ups. I'm thinking, okay, I got to get into this, because I'm going to be hooked up for 9 hours, and I can't really get out of my room, so I have to do everything I can now.
Without getting too detailed, peritoneal dialysis, is it rocket science?
It sounds like it would be rocket science, and I still kind of think it's pretty bizarre. Like the whole system of putting solution into your stomach and you're drained out with the machine. It does seem kind of like rocket science in a way, but after you get used to it and you're doing it every night, it's not that bad.
So would you fly a rocket?
I would.
All right.
I will.
All right.
I will take that. I will take that.
All right. So,
But
I don't know if I would fly a rocket, but
yeah, no, I'm probably. I would probably all die if I did.
Won't even ride a
I think
motorcycle.
that's what this industry needs, especially like at the clinic setting, is each clinic should have a patient advocate. Right? A lot of times those patients that do well on PD or home hemo, they're discharged from the in-center and then we don't hear about them again, right?
Right. Yeah.
Those patients that get to that route should be brought back to the clinic occasionally and have them talk to patients.
Yep.
Especially when men, right? Because men go through, more than women, go through a denial phase in dialysis.
Yeah.
Where they don't accept the fact that this happened to them. They don't
true.
believe it's happened to them. They believe they're going to get cured right away. They're going to come in for a couple of sessions, a couple of months, and then they're going to go back to their normal lives. And that's not the case.
So we've got a commenter. I believe Jim has also been on dialysis and making comparison to the clinic as definitely a more depressing place. Most patients are down and grouchy, prefers the home treatment and PD, and I think that's kind of a story that is pretty consistent among people who are doing home modality, especially on the PD side.
And that can happen in a lot of clinic, right? That's the culture it becomes, because a lot of clinicians work 6 days a week. Right? Honestly, a lot of clinicians are overworking themselves.
Yep.
They are. Those that are working 2 jobs, honestly, in my opinion, they're miserable techs.
Yeah. Yeah, they have no time for themselves or their family. If
Right?
that's what,
And they're not providing the best care possible.
No, for sure. Yeah.
Right? Because whatever weight they're carrying, they're bringing into the in-center.
yeah. Well, if you don't have time to deal with your own life, then when you're at the clinic, you're going to be divided, right? You're going to be thinking about family and finances, and if you're missing your temple or your church or things like this, you got to take care of your family, your health, and your faith. If you're going to take good care, like you said, you got to take care of yourself before you can, or love yourself before you can love somebody else. And to deliver good care, you also have to really take good care of yourself.
Yeah, but a lot of times, the technicians, we don't take care of each other either.
True.
Right? We
True.
don't. We're all self-centered. A lot of us are self-centered. A lot of them are self-centered.
Uh-huh.
Like for me, if I see somebody having some downtime, I'll be like, "Hey, what do you need? Can I help you?
Uh-huh. Uh-huh.
Go take a 15-minute break. I'll cover your patient. Or I'll
Yeah.
take them off. I'll put them on. Whatever you need, just go." We need to do a better job of recognizing it. Not only that, we need to be able to communicate that as technicians. Like for me, like if I'm having a bad day, whoever my partner is, my Jason pod, I'll be like, "Hey, look, didn't get enough sleep last night. Something happened. I'm not 100. Can you help me out today?"
Yeah.
Right? I'll buy you lunch. I'll do whatever I can. Right? But as long as you communicate that, then somebody knows. Otherwise, you just look like an asshole.
Yeah.
Mm-hmm.
Yeah.
Right? When you communicate.
Guys, I wanna shift gears a little bit, and I want to share a couple stories with you guys, if you don't mind.
Oh, for sure.
Omar may have heard them before, and they're really profound memories to me because, most of the patients were older that I worked with, and I haven't worked hands-on with patients for a while. I've done a lot of consulting and operations type of stuff, but I want to say like mid 2000s, 2005 or something like this. I had a young man that was like out of the military. He had a autosomal dominant disease, meaning it was passed down through his genetics, that caused kidney failure. He was on the radar before he needed dialysis. They had a fistula in his arm before he started. He ended up on dialysis in a clinic that I worked at. And every time he'd come in, he came in with a beautiful kid and a beautiful woman, right? His girlfriend and his child. And like I was a young man at the time, and like I thought his girlfriend was super hot. So like I would always be like, well, head popped up as soon as he walked in, right? But after a few months of this guy being on dialysis, he really declined hemodialysis, right? He had some access problems. He had some coping problems. And one day I saw him, and his girlfriend wasn't with him. And I said, where's whatever her name was, right? And he's like, look at me. This is what he told me. He said, he's 23 years old, right? He said, look at me. And he was like, I can't even get it up. That's what he told me. And she left me. And in my head, I was like, what up? And then I kind of really quickly grabbed myself to not say that, and not judge this person, right? But, this person left him because of what he was going through. 23 years old with his kid, right? And, the family was broken. Fast forward a little bit, the guy went through severe depression. He ended up, contemplating the worst, having to go through psychotherapy sessions or, with the social worker. He eventually got transplanted, so his story turned really good. But, thinking about what his first answer to me was, it was kind of like a sexual thing that he brought up, right? He had this perception that that's why it happened. I don't know if that's why it happened or not. I'm sure it wasn't the whole reason, but maybe it's a hard thing to deal with, somebody who you love going through this thing, right? Before you're married, because they weren't married. But then the same clinic, in a pretty short span of when that happened, I have a patient who is like 88, and he walks with a walker. So when he walks, and he's like, that noise, right? Scraping the walker across the floor and just shuffling across the floor. And that's his normal thing. But this day he walked in, he was smiling, and I think he floated across the floor, right? Like big old Kool-Aid smile floating across the floor. I said, hey, what's going on with you? And he took out of his pocket a bottle of Viagra, and the doctor gave me this. And he's like, watch out, right? He's like, pow, pow. He's telling me, I'm going to go home and I'm going to cause some trouble, right? So I want to tell you, like, the entire clinic, we're like celebrating with him pretty much. Like it made us all like happy that this guy, 80 years old, the doctor cleared him for Viagra, you know.
Small
and
victories.
He's gonna go and he's gonna go have some fun, right?
Yeah.
So, you know, the first story I said is about a young kid and his loss of his relationship. The second is about an older man. And a few weeks later, this little old lady comes into the clinic, and she's pissed. And she's shaking a bottle of Viagra. And where's Dr. So-and-so? Tell him don't give this shit to my husband. I don't need this. We've been married for blah, 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 blah. You know, I think it caused the opposite, right? Of like, number one, the young kid who, in his mind, sexual impotency caused him to not be able to sustain his relationship, to this older person who, after years of marriage, his wife was like, no, now he can do it again. That was going to ruin the relationship. It was the converse, right? So, you know, we talked about kind of dating. We've talked about the age of patients. What can you guys say about the impact of kidney failure with sexuality? And I want to think of two things here, because we're all men here. Mm-hmm. So the young man, right? Men are actually very mental in intercourse, right? Could it have been the new change in him? And then also, what did the old man get for his impotence? Viagra. Why couldn't the young man have got the same thing, right? Mm-hmm. But any experience or any thoughts on sexuality, kidney failure, if you feel comfortable?
Yeah, I feel comfortable.
You mentioned you're a single gentleman, you know, dating, peritoneal catheter, these sort of things. Like any experiences, guys, that would like to start?
To that story, that's a pretty good story, honestly. I wonder about that type of stuff, actually. and there are people that talk to me with similar stories of their spouse leaving them, and it's pretty sad, I'll be honest. And I could see it. And like you said, sometimes, especially a young man that's not all the way there yet, and he hasn't grew up all the way, he wasn't able to have that warrior mindset yet, and you do kind of fall apart. And I can see possibly why a woman would leave him. You know, I think as a woman, you're thinking about survival, you're thinking about your future, you're thinking about how could this man really provide for me, and he's looking like this. And if he's deteriorating and he's shriveling up a little bit, I get it. It's hard. Yeah. And for him, I'm sure he's thinking the same thing. Like, look at me. I can't get it up. I'm going through this thing 4 hours a day, or 3 days a week, and you're just not all the way there.
Yeah.
And so I feel for him.
I mean, I don't know. I'll be honest. I don't know that I would be able to, if I was 3 days. Just like I said, I'm doing a head check right now. Mm-hmm. Like, the thought of massive change, and I'm still in that change. I don't know if I'm thinking about sex too much.
Oh, for sure, you're not at all.
Know?
No, you're probably not. But as men, we're not going to tell somebody we're having problems with our sexuality.
That's a good point.
Yeah, we're not.
Yeah.
No, great point. Can I rebut on that? When that person felt comfortable to share it with me, it actually, in a way, kind of validated me as a care provider of, like, I'm identifying with people correctly. You know, like, nobody's going to tell you those sort of things unless you've got that tightness with them to where they know you're not going to judge. And my instant judgment was towards the woman, which I think you just addressed very well. It's like,
it's not
that's what
just
happened
we're not
after.
going to tell us, like, as men, that's a big part of who we are.
Yeah.
Right? And with my experiences, a lot of men will feel like the less of a man because they can't get it up. Mm-hmm. Right? I had a similar patient who was 80, Dominic Matoyer. Every Friday he was happy because he had his blue pills in his pocket and he was going to Vegas to see his wife. Right? And I think the older men who, they already had all the sex they wanted in their life, right? At 80, that's probably not your concern.
Oh, for sure, yeah.
Right.
I will rebut.
Right, yeah.
So I ran a nursing home for a couple years, and
there's some dogs.
There was more sex in there than like, what do you call that? Coachella. I mean, it was going crazy, man. Seriously, like advanced age, in some cases have like hypersexuality. which is
Well,
really
is it
odd.
because it's advanced age, or it's because it's something new to them? That might be a big factor. It's like, hey, I can have a different lady every night in here, right?
True. That was. I'm thinking about one patient. Every time we had new skilled patients, he would come in and
and
sweet talk them.
I
Was crazy.
I had a similar experience with a patient. He's like, I was with this one this night, and I was with this one this night at the nursing home. And I'm like, man, I don't want to go to nursing home when I'm old. I might catch something.
So on that note, we talked about the sexuality. Omar, you mentioned the importance of your family. Justin, I'm assuming maybe one day you would want to get married, or is
For
it
sure,
something?
yeah. I would love to have a family and be married for sure. I think that's one of the main things of life to experience.
So I'm really interested here because you're in a different place than me and Omar are. Like when I'm married, you're married. But two, if we were not married, we've went through our own hells, but not the same hell that you've went through, right? And the warrior mentality that you have now. So I'm really interested to hear, like, what's that person that you're looking for, like, with this perspective, this lens on life that you have. What's that person like that would complement you and help you to live out?
Yeah, dating's interesting
vision?
for sure. After I was done and accepting everything, I did go on a couple of dates, and one in particular, I did explain this story before. Dating on dialysis is interesting for sure because, especially with my age, everyone's also younger as well, and I think that for a girl, it's really hard to, unless if you first met them, it's very easy to opt out.
Right.
And I would tell them possibly the first, or not even the first date, maybe third or fourth date, and I'd tell them, hey, look, by the way, I actually got hooked up 9 hours a day. Like, I don't know how you feel about that, but that's what I'm going through. And most of the time, well, only a couple times, they eventually, and I don't even blame them, I'm not even mad about it. They just kind of just say, you know what, I'm not really looking to be a nurse, and I'm so young, I'm in my prime, I don't want to make this a situation, but I'd rather not deal with this. And I'm glad that they're honest, and I've come across that a couple times, and and I'm still kind of learning and still figuring out a way I can deal with this, but it's definitely a situation, and I think I would have to find someone that's very accepting, nurturing, and willing to be. And like I said, it's hard because if they just met me, I mean, you got to think about if a girl is still young, she doesn't want to be a nurse. That doesn't sound appealing to anyone.
Right.
So I have to try to figure out a way to be that guy and be like, look, hey, I can do this, and I'm gonna beat this, and this is what I'm gonna go through, and I'm gonna have you be with me. And I have to really sell that to her in order to get her to feel, okay, I'm down. I want to be your ride or die. I'm down to do this.
Yep.
And that's hard. That's another game that I never had to play. When I was younger, I didn't have that situation. I just had my game. Now this game is I have to sell this that I'm gonna be alive for a while. I'm gonna beat this.
Yeah.
And that's a hard kind of game.
I think the encouraging thing about what you just said for me is, and kind of thinking about work ethic and dating ethic and all that sort of stuff, like my generation versus your generation, then the 20s, the people who are in their 20s now, is that people are actually thinking about the long term, which is, I think, should be encouraging to you as well. That, when they say that, they're actually thinking down the long run. So there are actually people who are settling down still, which is is actually encouraging, I think, from the 20s to 30s, because most of them are just kind of bouncing around, adding a body count, right?
Oh, for sure.
I don't think you have a problem getting a date. You're a hip guy, good-looking guy, successful, creative, passionate. I don't think you have a problem getting a date.
I don't think it's a problem getting the date. I think it's having someone long term.
Yeah.
I think those little dates and like having a little fun, night here and there is quite easy. It's just those nights are not appealing to me anymore. I'm not interested in looking for those one night and a couple of days and they're gone. That's a lot of money and energy to be just like, okay, see you later. I would love to find someone that's just down to really be a part of my journey. And like I said, that's a hard thing to find, and I have to really kind of sell that to that person. And with my mentality and my, who I am, I believe I can do that. I'm a pretty confident person. So if I say, I'm going to beat this and we're going to figure it out, I'm going to figure it out.
Yeah, I actually have a lot of optimism there as well. I'm kind of like excited for you.
Thank you.
Because
Appreciate that.
you're at a point in your life where, like, you're gonna get a gem. You know what I mean? You know the person that you're looking for, and because of what you went through, like, I think you're gonna endure until you get that person, not like settle for less.
Yeah, it made me a better person. I honestly, I always feel like this was some sort of plan, possibly because I think before I was kind of living my life a certain way, and I think I respect my time a lot more than I do ever before, and I just figured the things I do now is stuff that I really respect and I'm willing to do. I don't like wasting my time anymore. So I think this way of my new life, I actually really appreciate, and I think I'll meet someone, maybe on the same page.
I think so too. Guys, I'm really appreciative of the night. We started a little later than normally. I just want to get one final thought from each of you. Omar, you know that we really like to kind of focus in on, what last piece of advice could you leave to the audience? The audience that has been watching us is predominantly a young male population, kind of right in your in your age group, 25 to 35 male, about 90% male here in the United States. So I'll kind of ask you to speak to that group. We've really focused on kidney disease, kidney care tonight, but we've tapped into what really life means to each of you. We've tapped into a bit about love or romance and marriage and family. So let's start with you, Omar. What is the best advice that you can give tonight to those 25 to 35-year-old males, and forgive me all the females who watch the podcast, which 10%, right? So the few of you that are watching us, forgive me for excluding you on this, but definitely, hopefully, this will benefit a male in your life, and you can share that with them.
I would say find something you love and make it your purpose.
So for you, that is?
Being a dialysis tech.
Being dialysis tech.
Yeah, it's something I made it my life purpose, right? Dialysis is not what I do, it's what I am. Right? That's my mentality now.
Love it. Justin.
Yeah, that's cool to hear. I think my advice to the 25 to 35 is acceptance and having good discipline. I think if you put those two together, you'll be able to figure out not just dialysis, chronic illness, just anything in life. Because at those 25 to 35, it's a very pivotal time of life of becoming who you are as a man and running it with like, that's who I am and I'm going to run with it.
Yeah.
So I believe accepting who you are, having high discipline, and that will set you up for success for anything you got to, come your way.
Yeah, I love any discussion on discipline. We've talked about it many times in many episodes. My growing up has been volatile as far as discipline. I've had things I've been very disciplined in, and then unlike you, Justin, there have been a lot of things that I said I'm going to do this, and then after a certain period of time, I don't do it anymore. And the kind of things that would be important to those 25 to 35-year-old males, that especially in the high incidence populations, right? That are eating certain things, that are exercising or not exercising, that may have vices in their life like alcohol or smoking or drugs or sex, all of those sort of things. I went through those stages in my life. It's only now as I get older that I can focus, like both of you, on helping others. It's been my career since I was a kid, but like as far as purpose, it's really, really setting into me right now. It's the reason why we started the podcast. I'm so thankful for both of you and all the guests we've had in providing a different lens to the viewers that we have. Look forward to having you both back again soon. Justin, really want to hear more about your story, learn about your businesses, and about the advocacy that you're doing. So make sure that we get, we'll get all of the handles. We'll
For sure.
link them to the podcast episode and share away.
Cool. Yeah, absolutely.
Thanks, guys. Appreciate you.
Appreciate it.
Good night.
Yeah, I had a lot of fun.
Thanks, Justin.
This episode has been brought to you by Dialysis Education Services.